Good news for once, the UK death rate has reached a record low, but it's not quite as clearly great as it might seem. The UK's overall health improvements in death rate have actually stalled since 2011. Compared to similar countries, we're not doing that well on life expectancy. The death rate has been falling year on year broadly for a very long time in the UK, thanks to health improvements in big killers like cardiovascular disease and improvements in cancer treatments. When the COVID pandemic hit, death levels in the UK didn't actually fall year on year for the first time in a very long time. Thankfully, things have now normalised and we're back at a lower death rate than we ever had before. Worryingly, death rates in younger people, so that's people aged 20 to 44, have actually gone up. And that's due to things like drug overdoses, suicides, trauma, and alcohol. So why are we seeing this trend in the data? And why has there been such stagnation since 2011? Well, some of the biggest health improvements, things like stopping people smoking or improving treatments for heart disease, they've already been made. And that's what's caused this stagnation over the last 10 years. Now, new risks like obesity, inequality, these are new challenges to tackle. It's important to note that reduced death rates do not necessarily imply better life. Some people might live longer, but they might live longer with more health conditions which may reduce their quality of life so significantly that they may not feel they have much of a life anymore. This is something that's really been highlighted recently in the debate around the assisted dying bill, which has been put forward in the UK. We also have to consider the strain that this will put on the NHS. Back in the 40s, when the NHS was made, the death rate was much higher and people didn't live as long. But now we are seeing lots more people living longer and requiring more hospital stays towards the latter end of their life. So what's the takeaway? Well, prevention is key. Make sure you follow the NHS advice about staying fit and well and active. That could mean getting an appropriate amount of exercise and trying to eat well. It's important that we take a look and try and support policies that improve public health. Things like tackling junk food marketing or improving social care in the community. And as always, it's important that you contact your GP early if any changes in your body worry you. The overwhelming majority of disease has a much better outcome if it's caught early. So make sure you see your GP if you have any changes to your body you're worried about early. And if you're interested in more content like this, please follow my channel.